All of a sudden, we find ourselves talking about COVID-19 as the last topic in our show. That's a good indication of the kind of week we've had, no doubt about that. But New Mexico started to open up a little further this week. It's too soon to know what kind of an impact that's going to have in terms of the virus spread, certainly. But how about economically? And Laura Sanchez, there's a lot of things going on out there. Businesses are opening, but I think this new reality is showing a lot of businesses this is a very hard struggle to do, to pull off, just to open at 50% capacity and things of that nature.
It is. It's a moving target for a lot of these business owners. I think that there's staffing issues. There's a question about whether they can get their same staff back. Some of them, of course, we've heard they're able to, in some cases, get more in unemployment benefits than they get in tips, especially at a time where it's uncertain whether you're going to get the same volume of clientele that you had before. So they're struggling with those issues. I think there's also, I've been to a few, I've tried to go out as much as I can, in truth, because I'm just such a social person that I've missed, being able to go out. In any event, it's clear that there's some logistics issues with cleaning after every person or every party that sits at a table. There's just a process issue, and then you, of course, have delays related to that. And so I think there's just a lot of, and I hate the term, but it's the new normal. It's something we're just going to have to all adapt to and figure out our way.
Speaking of which, Dan, I appreciate Laura finishing with that new normal thing that we're just so used to hearing now. But when you think about things like Santa Fe Fiesta Council, Zozobra, all kinds of events in Santa Fe are canceled now. Balloon Fiesta's looking at their options. I'm leaving out a bunch, certainly. What can we reasonably expect in a few months? Is the new normal just honestly clicking down all of our entertainment options to a low ebb at some point?
So, if you're asking me what we're going to do in New Mexico versus what I think we should do, I think there's two vastly different deals. Look, I think, as is typical, we've lost all sense of reality in following science. You're looking at states where they didn't close down and weren't as draconian in the rules. And, they're not having the spikes that were out there. This is a virus as
I misunderstood. The states that didn't have draconian rules are not having spikes? Is that what you're saying?
You look at states like Florida that everybody said you're going to have this giant spike in 2 weeks after they have the spring breakers. Never happened. You go through, look at there's 4 states, and you look at states like Texas, you look at states like Florida. When you look at the percentages of people that are there and when they're having these giant spikes, it's nothing like people have predicted for them.
I think there are spikes. I wouldn't call them giant, but there's definitely been spikes in some of those states.
There's always going to be upticks. It's a virus. We're all going to get it. There's no way to keep us all from getting it. So I think this whole conversation about saying, look, unless you want to lock yourself in the house and never leave, at some point we have to realize that we need to, when you isolate the sick, when you take sick people and you isolate them, that's one thing. When you take healthy people and isolate them, that's tyranny. At the end of the day, we're not doing anything to prevent these folks. You look at what's going on right now.
I don't mean to laugh, but that use of the word tyranny is kind of cracking me up a little bit.
Tyranny, I laugh too.
I'm a student of history, and tyranny is a loaded word, dude. It's inconvenience is not tyranny. It just, I don't know. I don't want to get into that. But Lana, let me get you in here.
Okay, so I guess so you interrupted me 3 times, so I'm done with that one. Okay, thanks, Gene.
Okay, I gotta move on. We've had an outbreak in state prison in Otero County, Lana, and it's an interesting situation that just a few weeks ago the governor was saying we had nothing in our prisons, and now we've got a whole situation where critics said it was just a matter of time. How does that change the game in New Mexico?
Well, in terms of what policies the governor are going to do in terms of the greater community, not very much, right? It's very isolated. In fact, it's sort of good news for the greater community, obviously bad news for the prisoners, and I sure hope they're taking care of them. They say they have a plan.
But does that make the point that some folks, including ACLU, wanted a more vigorous release program out of the prisons to keep it from doing its thing in prisons? Does this make
I think you have to balance sort of public safety with these things. There's a lot going on. I guess I don't blame the governor for making the decision that she did.
Sure. Laura, pick up on that if you would, the idea of prisons and where we are on that. I agree with Lana. It's a very difficult situation to manage.
It is, and I hope that science is driving a lot of these decisions. I think that they have been. I think that there have been some overly cautious situation. Well, I don't know if they're overly, but they've been more cautious than other states. But I think they're appropriate for trying to avoid a real crisis here. I mean, it's clear that we have a shortage of healthcare, a shortage of ICU beds. The worst thing that could happen is that we have a terrible spike and then we're not able to care for the sick. And I think that places like prisons certainly are ripe for such close containment or close contact with people that you could really have an outbreak and it would be just terrible. And I also believe that there's a variety of infractions that people are in there for. And so some of the nonviolent ones, certainly some of the drug-related type of crimes are probably, you can make a determination on people who are, balance that public safety with the need for public health and make a decision that way. But it's extremely difficult. And I think hopefully people are using science to guide their decision making.
Good point there. Hey, Daniel, I'm curious what you're seeing for the mask or no mask thing playing out as you kind of get out and about. What are you seeing out there?
I see most everybody's following it.
Okay.
If you don't, you kind of get shamed into it, right? I mean, I've seen people walking in the stores without a mask, and everybody gives them that glare and looks at them. Other thing is the governor has made it clear that, you have to operate with the mask in businesses. So lots of businesses will tell you can't come in unless you have the mask. And so, and I want to make it perfectly clear, Gene, I'm not saying that the governor's done a bad job.
Mm-hmm.
I think clearly when we did this, you got to go forward with it. And the other thing I would tell you is that, what I was saying earlier is that, the difference between quarantine and tyranny. Quarantine is when you restrict the movement of sick people. Tyranny is when you restrict the movement of healthy people. And I think we got to be careful of balancing. Are we telling sick people to stay home, or are we telling healthy people to stay home? And if we don't get that clear, I think we're going to have a devastating effect on our economy at a time that we can't handle it, especially here in New Mexico.
Good stuff there. Hey, guys, I want to thank you very much. It's an interesting week for sure. We'll have to leave it there.